Everyone. It's so good to be here with you today. Welcome to our show. We are Lipedema Wellness Conversations with Gail. That's me and friends. And our friend today is Adie MacKenzie. Hello, Adie. How are you today?
Hey, Gail, it's good to see you.
It's good to see you too. I'm going to give a short introduction to Adie, and then I'm going to let her take it on afterward. So Adie comes to us from Memphis, Tennessee. She is a CLT, which stands for Certified Lymphatic Therapist. She has been working with Lipedema Simplified for about a year, and she gives us lots of information on a lot of the physical modalities to help us with our lipedema and lymphedema if we happen to have both, or lipolymphedema. Before I hand it over to Adie, I want to make sure that everybody who is here today, who is listening to us, just throw in the comments, um, who you are and where you're coming from. And if you have any questions during today's broadcast, please make sure that you type those in there, and we will address those questions that we can. And if you have the urges to give a thumbs up or a heart, please make sure that you do that so we know that you love us. Anyway, so Adie, um, when you, you came to us last year, we were really excited to have a CLT. What kind of things do you do as a CLT?
So, CLT stands for Certified Lymphedema Therapist. A lot of us are starting to modify that and use the word lymphatic rather than lymphedema because we're treating lymphatic conditions of varying types, including lipedema. Um, with that designation, I'm trained to recognize the signs and symptoms of these conditions. I'm trained to uh, take measurements and to apply therapies, which include compression, exercise, skincare, um, garment prescriptions, multi-layer compression bandaging if there is lymphedema present, and that's an initial phase of treatment. And manual lymphatic drainage, a hugely important component of what we do with our hands, massage-like component that is the part that most of our patients feel is a treat, generally pretty pleasant to experience. So that's kind of what it means to be a CLT. In practice, it really depends on the individual and what they need. For example, I've worked in a medical clinic that specializes in treating lymphedema, and in that role, I'm a physical therapist assistant. So the physical therapist does an evaluation and then tells me to apply the treatment. But in my private practice, I see people under my massage therapy license, and they come to me, and I'm actually in Nashville, Tennessee. And they come to my home, and we kind of assess what their needs are, how frequently they can come in, and a lot of times I'm seeing people when they've already gone to a clinic, so they're seeing me for maintenance and for avoiding things getting bad again.
Right, right. So speaking of Nashville, Tennessee, did I say Memphis? I'm
Yeah.
sorry. I'm
Well,
sorry.
Memphis is on our minds right now, so I
Right, I
understand that.
guess so. I guess so. Nashville, Tennessee. So I see that we have Lisa. She's a patient from Nashville,
Right.
and then Denise Gleason
And
is
Denise is a therapist here in Nashville.
yeah, is also
Mhm.
from Nashville. So hello, all of you guys from Nashville. I don't know why I said Memphis. I'm sorry about that. We have Megan Turner from South Australia is here today, and Dottie Norris is here from Indiana. So we do have people from all over the world, Australia to Tennessee and Indiana, and
So exciting.
it's really nice to have people from all over the world, and it's also nice to know that with you, what you do is recognized all over the world as a treatment for lymphedema, and it's becoming more and more known for lipedema. Lipedema has been something that seems to have been on the back burner for a long time, and we're now starting to realize, oh, these people who deal with lymphedema also have lipedema involved, also, with that. So when you, I'm gonna go ahead here. If anybody who's here on the call wants to be able to reach out to you, I'm going to go ahead and put your email address in, because I know that a lot of times people will say, "Oh, I want to ask you a personal question." No, not a personal question, a private question.
Yeah. Yeah.
you know. So I'm going to put your email in,
Great.
um, and it's going to also go underneath our pictures. So
Yeah.
when we were talking earlier today, I asked you about um, pneumatic pumps,
Yeah.
and I know for a fact that you have a passion about the pneumatic pump, or pneumatic pumps in general.
Yeah.
And can you tell me more about just anything, how
Yeah.
they work, how you can get one, anything that you want to talk about with the pneumatic pumps? We would love to know more.
Yeah, absolutely. And there will be there's a nutritionist named Jean Lamontia who is in Canada, and she has a wonderful website, and she's going to be posting a blog that I'm doing on this topic. So I can people can write to me and I can send you a link to her site. But the situation with the pneumatic compression pumps that I am enthusiastic about is that they are medically prescription oriented devices. I'm not enthusiastic about buying things off the internet, buying them used on eBay. These are very much, medical durable medical equipment devices. And full disclosure is I am a clinical advisor to one of the pump companies, Eros Medical. And so I'm, of course, extremely enthusiastic about our products, but all products in general that are under this prescription orientation that are designed to treat lymphatic dysfunction are designed in such a way that they help move fluid out of a limb or other body part and back toward the central system. So, that being said, there's a lot of different configurations. Some of them will just treat one or both legs without treating the abdomen and groin. That works great for some people with some kinds of swelling, and for other people, that's a real big problem. Some of them treat for breast cancer related lymphedema, such as I personally have. Some of them just treat the arm and don't treat the chest and breast as well. That's fine for some people. And for other people, that's going to just push fluid back into the chest and the breast. So that's another important factor for it being a prescription device, and for making sure that you're working with a medical provider, either the therapist and or the physician, who can determine exactly what you need as a patient to get the right um, result from your use of the device.
Yeah, and I believe that some actually have like a head and neck
Yep.
attachment also.
Yeah.
And and I know that several of our members have lipedema and or lymphedema in their arms and in their legs
Mhm.
and in their abdomen. I mean, it's
Mhm.
like they're not total full body issues, maybe not in their neck and head, but it's like they have flow issues.
Yeah.
So when you're using a pneumatic pump, is there a method of making sure you get everything taken care of without being, I mean, do you do it all at once? Do you stage it? I mean, what is the whole process with this?
So again, I'm just going to reiterate that your relationship with your physician and or certified lymphatic therapist is going to be really critical here. I have currently a patient who was misdiagnosed with lymphedema in her arm uh, shortly before the pandemic, and also has some neurological issues. And so the therapist that she saw sent her home with a pump that would treat the head and neck and both arms, and had her doing this for 4 hours a day. This led to her having worse problems and having swelling in other places. So she, unfortunately, it was right before the pandemic. The therapist who got all this for her and set her up then was no longer available to her. She didn't have, access to even like video chat like this.
Right.
So she was spending 4 hours a day not being active, pumping too much. She was having rebound swelling, and it took a long time for her system to normalize out afterwards. So you really do need guidance. You don't, until you know that what you've got is working for you, you don't want to go totally independent with it.
Right. Right. And I do know that sometimes we have a couple of support groups, some Facebook support groups.
Yeah,
Someone will say, "Oh, look what I found off of Amazon for $99 or 100 and, $10 or something. And I'm going to use these." And I'm thinking to myself, be careful. You you don't know what you need, right? Because some of us, I'm sure that somebody could use that, but we don't know for sure if they're really what we need as an individual without some guidance.
that's right. And
Because
they may work just fine, but you don't know that. And if you haven't had, like, if you've had a relationship with a physician, a CLT, somebody who's told you that's fine for you, then maybe it's worth a try. Many of those devices, I can't say most because there's so much out there, I don't know,
right,
but many devices are designed to be worn if you're immobilized, if you're in a hospital bed and you don't want to develop blood clots. So in
right,
that case, they can just squeeze and let go and squeeze and let go, and they're going to help keep that venous blood moving, but they're not necessarily going to address your lymphatic condition in a way that is beneficial and effective. And even, if you're not sure you've got the right thing and you end up with a tourniquet effect, that can actually be damaging to the lymphatics. So, you
right,
really, I just encourage people to try to have that partnership, even if it's a video partnership with somebody who's trained in that arena. You
right,
know, with our organization, there's myself, and then there's Veronica, who is also a CLT,
right,
who can help people with these things if there is no CLT in your area who's going to be able to help you hands on directly.
right. And it's not just for lymphatic pumps, pneumatic pumps, but it's also for finding a good fit for compression. It's learning how to maybe do dry brushing if you need dry brushing, um, manual lymph drainage massage.
Mhm.
What other types of things we might need to give it a try and see how we respond. And I know that you and Veronica both have um, have worked with our community, and I had Veronica working with me on my arms,
Mhm.
and it really made a difference having a coach for learning how to do um, my my manual lymph drainage
Yeah.
with Veronica. And I know that you also coach our members on learning how to do manual lymph drainage, finding a compression that might support that, and being that cheerleader saying, "Hey, look what you've done so far,"
Yeah.
and those sorts of things. And having a coach is vital. So I want everyone out here to know that if you would like to reach out to Adie, it's Adie at lipedema-simplified.org. And she'll respond to you and answer your questions and those sorts of things. When when the year ended, 80, we were all excited about something that happened at the end of the year.
Oh, yes.
And I kinda wanna talk about that.
Yeah.
I I don't know a lot about it, but I'm sure as a CLT, you've heard a lot about it, but the the Lymphedema Treatment Act was passed. It was part of the omnibus bill,
Yes.
and, it was 10 years in the process of passing. What can you tell us about the Lymphedema Treatment Act?
So the Lymphedema Treatment Act is a really small bill, but it was incredibly difficult to get passed because it requires Medicare to create a category of durable medical equipment that includes compression bandages and garments, which has never been something that was covered by Medicare in general. Some Medicare supplementary plans, I believe, have covered these things, but in general, Medicare has not covered that. And the problem is that if patients come for lymphatic therapy and they go see a CLT for, 10 or 20 visits to get their swollen body part under control and in its best condition, we believe that that compression is going to be critical to maintain that. The pumps being something that is not disposable, those were covered and are covered by Medicare. But the garment, which is something everybody's going to use, not everybody's going to use the pump, but pretty much if you've been for lymphedema care, you're going to need a compression garment. If that's not covered, then what ends up happening is we have a revolving door. Patients end up going home. They're not getting the maintenance care that they need. They end up with a wound or an infection. They end up back in, best case in just seeing the therapist, worst case in the hospital with an infection. And it ends up costing the taxpayer more because we didn't upfront provide the expense of the garment. So that's really what the Lymphedema Treatment Act does. It just requires Medicare to cover those compression items, the bandages and the maintenance garments. And hopefully that will drive private insurance to also cover those things where they are not currently covered.
Right, right. And, so because garments are disposable because we have to have them, we can't use them forever, right?
Right,
We have to,
right.
we wear them for, what, 4 months, 6 months,
6 months is usually the
yes,
general.
and we need to have more because the elasticity gives
Mhm.
and everything. They were considered disposable.
Right,
Yeah.
right.
And now with Medicare needing to cover this, being told to cover it, other insurance companies take their cues from
Mhm.
Medicare.
Yep.
So other insurance companies are more likely to cover them. And now is there and so basically, tell me if I'm wrong, but it also made it so there was a way they could prescribe it. Is
So,
that part of it?
I mean, these things are already prescribed. It's just that now, with a prescription, Medicare will be required to cover. What
Okay,
exactly that means, my insurance company has a specific separate category of DME that covers my compression garments. Being post breast cancer, I get better coverage than perhaps if I had lymphedema due to a trauma or a burn. But I still have a share that I have to pay for my garments.
right.
And that will continue to be the case. I mean, patients are not going to be saying, I need garments, I need this many, my Medicare is going to cover the whole expense. I'm not going to be out of pocket. That's not going to happen. There
Okay.
will be some sort of co-insurance on the part of the patient as we understand it now, although we have a year for this to unfold as to what that's actually going to look like.
Yeah.
Um, but but it will mean that if the patient has a prescription from their physician that says that they need a compression garment, that there will be some level of coverage from their Medicare for that.
Oh, that's wonderful. That's
Yeah.
wonderful to hear.
Yeah.
Yeah, and I know that Heather, the person who worked so hard for this, she had twin boys,
Mhm.
and one of them was born with primary lymphedema,
Right.
and that's one of the reasons that she pushed so hard for this is because she realized she had to have his garments, his compression wear for well, he's a teenager now,
Yeah.
for years and years, and for the rest of his life, he's gonna have to be able to get his compression, and she realized how many people weren't able to get compression due to it wasn't covered. So we're really grateful for her and her team that they worked so diligently for us.
Indeed.
Yeah. Um, if there was anything else, Adie, that you would like to talk about tonight, what would it be?
Well, I just wanted to my initials aren't up there anymore, but when my name flashed at the beginning, there's another set of initials behind my name, which is NBC-HWC, and that's National Board Certified Health and Wellness Coach. So that's the other thing to keep in mind, that health and wellness coaches kind of are skilled at helping people define their goals and find the baby steps to attain them. So although I am not able, and I think it's so critical that we do have such great nutrition coaches with Lipedema Simplified, and I love them. I can't advise a diet or a nutritional approach for anyone who wants to do coaching with me. But sometimes what we really need is help figuring out how to make those nutritional goals work for ourselves, how to stick with them, how to see our way to the baby steps that will help us attain the why. Why do we have the nutritional goal? Are we trying to have more energy? Do we have a specific event that we're trying to improve our well-being to attend? Those kinds of things a health and wellness coach can be very helpful for. So, that's coaching can be a long-term relationship. It can be a few sessions, but it's more of a motivational and focus kind of a relationship. In our case, sometimes it really is critical for a coach with Lipedema Simplified to be able to be a CLT in that setting
Right.
and to be able to really help the person who doesn't have a local CLT to gain some of that kind of skill. So it's not without that educational component.
Yeah, yeah, and that's a wonderful thing. We do have so many of our members are the members of our community. Some of us are in rural areas, or we just don't even know where to look or the questions to ask if we want a CLT that we see one on one. So if you were to say, what would you say to me if I was going to be searching for a CLT? What kind of questions do I need to ask? Um,
Mm,
where do I go? Where do
yeah.
I even go to get a diagnosis?
That they're getting the diagnosis, that's tricky because we still have a medical community in general where physicians in medical school are given anywhere from a couple of hours to a couple of days worth of training on the lymphatic system and what lymphatic dysfunction is. If they ever even mention lipedema, we're really lucky. Hopefully they mention lymphedema. Um, and that's a little more recognized because cancer care is so huge in our nation. But finding a CLT can be really tricky. I think, fortunately through Lipedema Simplified, we have some access to resources, and hopefully we have some lists of the websites that a person can go to and put in their local area
Right,
and search for a CLT. Some of the schools that train, um, the Norton School, the Vaughter School, some of those have websites where there's listings of their trainees.
right. I
Uh,
believe I believe Lipedema Project has a directory,
Great.
lipedemaproject.org. That's our research um, portion of Lipedema Simplified. Leslin teaches for, Gunther Klose,
KLOS.
Klose, and that's another place, to look, but we get that question a lot, "How do I even know where to start?"
Yeah,
If I am if I am still undiagnosed or quote unquote self-diagnosed
yeah.
with lipedema, like I know I have it, I just don't have an official diagnosis. What do you think my first step should be?
I think the first step is to identify if your primary care physician is gonna be on board with you. So, having that conversation with them, I've got a great PCP. I She would totally be willing to send me to a vascular doctor, or to, if I had unexplained swelling and pain, she would be totally willing to refer me to a physical or occupational therapist who's a CLT for an evaluation in that setting. And so that can be a good place to begin. Um, in the absence of a primary care physician, it can be really tricky if you have a relationship with a cardiologist, a vascular doctor. Those physicians are often helpful with that. If there's a major medical center in your general area, such as uh, here in Nashville, I work at the Vanderbilt University Medical Center. Uh,
Uh-huh.
that is a major medical center. Someone could contact Vanderbilt and say that they think they have lymphatic dysfunction, and can they please help guide them to a provider. Um, but it's not easy. And, that's why I want to offer to try to help people navigate that wherever they happen to be. I can't even speak to, we have people all over the world on this call right now. I can't even speak to what happens in other countries. I've been trying to learn about Canada, but that's
Right.
challenging.
Yeah, and it is difficult because it's it's hard to know, in other countries just what how their system works.
Yeah.
It's hard enough to know how our system works here in the United States,
Yeah.
right?
So I do wanna back up 1 second, Gail. I
Okay,
don't mean to interrupt you, but
that's
the
fine.
the other thing that a patient can do is look for a massage therapist who is trained in at least lymphatic drainage therapy, because a massage therapist who is trained in lymphatic drainage is not going to hurt a patient with lipedema. They're going to help you. They may not be able to guide you to all the garment choices and the exercise and all of that, but they're going to have manual skills that can help you feel better. So,
Right,
that's one thing that may be more available to more people in more areas. So don't forget about the massage therapist CLT, or the massage therapist lymphatic drainage therapist. Those people can be helpful.
right, and that's one of the things I did. Once I figured out that what I have is lipedema,
Mhm.
I I never did much massage. I just was not into massage, I thought it was, frivolous. I thought it was pampering and that I didn't have a reason to spend my money on myself that way because I thought, sure, I got a knot in my shoulder, but it'll be okay. I'll put a baseball back there and rub it on the wall.
Mhm.
I don't really need a massage therapist. So I just let it go, let it go, let it go. Now, a physical therapist, but it's covered with my insurance.
Right.
I'll go to the physical therapist, but a massage therapist was always like, "Yeah, no, I
Yeah.
don't need someone to rub me," pretty
Yeah.
much. And then my husband is a ski patroller, and one of the ski patrollers on his team is a massage therapist. And I just called her one day and said, Do you do lymph drainage, lymphatic drainage, manual lymph therapy?" And she says, "Well, of course I do." And I said, "Can I make an appointment?" And it was actually my first massage that had a purpose
Yeah.
in my brain, that I
Yeah.
could justify, and it became a non-negotiable for me,
Yeah. I have
and I love it.
it makes you feel so much better.
Buoyant.
Yeah.
I pee before I get on that table, and as soon as I can get down to the bathroom again, I got because I know things are flowing.
Oh, she sounds like she's good.
She's good, and but, she gives me a 90-minute massage.
Yeah.
She I didn't realize because 'cause I'm thinking, "Oh, I thought she was doing manual lymph drainage. Why is she working on my neck and shoulders?"
Mhm.
You know? And I would ask her, "Why are you working there?" And she would talk to me about, opening this and opening that and feeding this and flushing that, and she'd start talking to me about it, and I'm like, "Okay, I'm not gonna talk anymore, I'm just gonna enjoy."
Yeah.
You know?
Why not?
It
That
really
rest and relaxation that you achieve during the session is also part of the lymphatic flow, and getting
Right,
these muscles loosened up helps your system move things, and
right.
yeah, I mean, all of it is so much part of your well-being, and your improving your lymphatic flow, which improves your immunity, which, just in general increases your well-being.
Yeah, yeah. So, I would encourage anybody who already has a massage therapist that they go see, give them a call and see if they do manual drainage
Yeah.
because sometimes, sometimes your massage therapist might not know it, or they might know it, but you haven't ordered that particular bundle, you know.
And if your therapist is actively maintaining a license, they are going to be required to get continuing education I don't know, every state in the United States is different, everywhere in the world has different requirements. But here in the United States, every state will have some amount of continuing education required for licensure. And a therapist can go ahead and take lymphatic drainage courses if they want to. I will say, and I believe that the people I know here in Nashville on this call who are treating this will say that there are not anywhere near enough therapists. I'm turning away business all the time. Most of us are overwhelmed. Um, that is a great field for an aspiring massage therapist who wants to build a busy practice because
Right.
there's a need. There's a huge
Yeah.
need.
Yeah, I truly bel I hear what you're saying, I double it because it's like my gal my therapist, she's busy, and
Yeah.
she has said to me, "Since I've started working on you," she said, "I mention it to people now." She said, "I used to n" she didn't mention it very often,
Yeah.
she just waited for someone to request it.
Yeah.
And she said, "I'll mention it to some of my clients." And they're like, "Oh my gosh, I didn't know you did that."
Yeah.
Because they were in for they would get a different package from her
Yeah.
than the manual lymph drainage. And so her business has picked up because people are starting to say, "Oh, Liz does this, Liz does this."
Mhm.
So I was going to read a question from, let's see. Someone says massage therapy that works is not a treat, it's a treatment. And that's true. It is a treatment, but
Mhm.
man, it sure feels good,
Yeah.
when it's done right.
Why not?
Um,
Why not experience something that's beneficial to your well-being and also is, uh, treating you to
right.
something enjoyable?
Yeah. Juanetta says, I had MLD this morning.
Mm. Hi,
Um,
Juanita.
Hi, Juanetta. I had to get off the table for just that reason. Have been visiting the loo all day. Yeah,
Great.
my problem is when I'm on my manual and drainage table, I'm naked. and her because she's working the whole system, and I just stripped down naked, and I have to go down the hall and down the stairs to get to the bathroom because she's
Bring a
in a
robe.
private studio, right? And so I just have to wait, just keep breathing. I tell myself, just keep breathing. Um, and then Megan wanted to know, what is the best pneumatic pump? And I know that you probably have to watch how you say this, but what is the best pneumatic pump for someone with lipolymphedema in both legs, arms, and abdomen? I live rurally. It's so regular massage isn't an option.
So there's not a pump that I can recommend as a specific pump. I can say that you probably want to use a pump that has a pants option for the legs, not two leg sleeves, but a pair of pants that's going to also treat, you can't see my waistline, but also treat the abdomen, the groin, the genital area, and get that whole thing going. And then you probably want an arm garment that doesn't just end at the arm, but that has a trunk piece. And I believe that one of the companies, and I'm not going to use brand names here, but one of the companies has like a vest top that encompasses both arms. Many of them have a vest top that's just one arm at a time. But you don't want to do all those things at the same time. So you want to kind of, do an hour of lower extremity, lower body, maybe do an hour of upper body at the end of the day. You want to separate the amount of time you spend on these things. The pumps, a lot of times what is the best brand is what's most available in your area, like who's the great rep in your area that's going to help come and fit you and demonstrate and help you determine that you've got the right thing and that it's set properly for you. And so there was a brand here in Nashville where I had a fantastic rep, and that was the only brand I ever used. And when that rep left, I couldn't get the same level of assistance. So I started using other brands to recommend to my patients. So I think, again, that's a good thing for, even if you're not going to see your CLT regularly, if you have that relationship, then they can help you start with the pump.
Right. And um that's a good segue into a question. So if I'm using the pump, let's say I'm pumping my legs. I'm just using my leg pump regularly. Do
Yeah.
I use it every day? My CLT would know, right?
Your CLT should advise you on that for sure,
Okay.
because everybody's different, right? And I don't know your entire medical history and any kind of cardiovascular concerns that you might have or anything like that. And that's another reason why these are prescription only, medically guided
Right.
devices.
Right.
Um, at the same time, many of my patients do find that they like to use that pump every day, that they benefit from. A lot of my people who do it use it before bed. So they will pump for an hour before bed. It really chills them out. And then they get a good, they pee, they get that done, they get a good night's sleep, and hopefully don't have to get up multiple times at night.
Right.
Um, so, that is all the stuff that you want to, at least, even if it's a virtual CLT relationship, you want to be able to really go through your own health history and your own needs and your own lifestyle and your own, like, what's going to work, because you don't want to make yourself feel guilty if you're supposed to use it every day, but you can't use it every day because of factors. So, there's a lot to determine in there.
Yeah. And these questions are questions where that um and discussion is to get you thinking.
Mhm.
And then possibly as you're thinking about all this stuff, write down your questions. And then when you have your virtual meeting or your in-person meeting with a CLT, you have those questions. So we're here to stir your thought.
Yeah.
There's one thing about the lipedema community and the lymphedema community is because we live with this daily, we're constantly trying to find the next best thing for ourselves and decide how can we shorten our routine down, because some people say it's a full-time job.
Yep.
Well, it can be, right? And
Yeah.
so we try to find, how do we get things more compressed so we have more time to, for our daily lives. And so when you talk to your CLT, when you talk to your PCP, let them know what you're doing, let them know what we have questions about. Do I need MLD and pump and this all in one time? Well, probably not, but maybe you can develop a routine so that it takes up less time in your life. Um, I am going to answer Karen Sohn's question. She wants to know, should we get a CAC heart MRI? And Karen, at this time, um, on this particular live, neither one of us can answer that question about a coronary artery calcium score. CAC heart MRI is, I believe, what Karen's talking about, and neither one of us can answer that question.
Oh,
That's something that you're going to have to ask your PCP or your
cardiologist.
cardiologist um, for that, and discuss that with them. But we can't answer that. We can't give any medical advice like that at all.
The only thing I can say is that some people really do need that kind of information before they start pumping or even addressing swelling, and other people do not. That's
Right.
it's not pertinent for them. So that is a question for your medical provider.
Yeah. Megan says, thank you so much for the advice. I'll check with my massage therapist. I've been swimming daily. Yay, swimming. And
Um,
find that's so good to pump my lymphatics too. Is this just as effective?
so you're referring to the pump, I believe there.
She wants to know if swimming daily is just as effective as the pump.
Right, right.
Yeah.
So what I personally believe, and I think this is borne out in the research, that exercise is the single most important thing that we can do to keep our lymphatic flow optimal and healthy. Swimming is one of the best things. Well, I wouldn't say swimming. Exercising in the pool is one of the best things because you're getting full body compression, at least from here down. If you're walking in the water, if you're swimming and you're on the surface of the water, it may not give you that same level of compression. So your legs may not be getting as much benefit from the compression factor in that, but you're still getting the exercise factor. The
Right.
pump would be an adjunct to that. I wouldn't say it is just as effective. It's effective in a different way. Um, there's no reason that the two things can't. My people who have lipedema, who are the happiest with their self-care, use both. But the exercise is the most important thing you can do for your overall well-being.
Yeah. Yeah. And when we talk about exercise, we're not talking about high intensity interval training, or super heavy weights. We're talking about consistent, gentle, not super stressed exercise, because we also want to make sure that we're not overdoing it.
So we're talking about exercise to your appropriate fitness level and capacity.
Yes.
So, pushing yourself to a place that is overly challenging can have the opposite effect than you're trying to achieve. So, yeah, so it doesn't, if you're a super fit person, then you can push it a little harder. You might find that that high intensity interval training is safe for you. But most of us who are dealing with chronic conditions are probably not going to be that person for whom that kind of exercise is safe. Please don't start something without some guidance if you have any doubts. Usually walking in the water, walking in your neighborhood if you're able to walk, that kind of thing is a safe place to begin for a period of time that's comfortable to you, you know, that's a really tough thing, and that's another reason I really encourage the relationship with the professional to guide you.
Yeah. Yeah, and, we have I I, I have connection with a lot of the community members, and we do have several of our, members who won't miss their water walking.
Yeah,
They use a walker or a cane, um, to get in and out of to get to the pool, into the pool. They check their pool out, make sure that that they have the steps in and not the climbing in one.
yeah,
So they go to several different gyms, several different pools. They need to make sure that the handrail that's on the pool goes completely out of the pool so they don't fall, and they can park their walker, or they can
yes,
make sure their cane is right there, because our safety is of the utmost concern. And yet they won't miss walking in the pool because now they can walk
yeah,
without having to use the walker or the cane for stability,
yeah,
and they're buoyant, and they can do we do, what we call Miranda, which is a stretch, um, thing where we do a lot of leg work and upper body work, and just, learning to stretch and keep our body moving, and we have that with Lipedema Simplified's, tribe membership,
yeah,
and our members will take those exercises to the pool, and so they're actually able to do lunges in the pool.
yep,
They hold the side and they can do the lunges or plies, or, they lift up on their toes and stuff, because of the buoyancy of the pool helps that, as it's compressed, as it's the compression and the water movement and all that. So they combine all of it together and they love it.
there's
I
a type of Tai Chi that's developed for doing in the water called I Chi.
uh-huh.
Um, and that's another thing that I've found many of my patients have just loved, this slow, controlled form of movement in the water, along with the particular breathing that is appropriate for it. Just soothing and calming and great for moving fluid.
Oh my gosh. So it's called I Chi
AI dash
AI.
GHI is how the clinic that I worked in for a long time doing lymphedema, we had a pool in our clinic, so lucky. And that was one of the most popular classes and exercises
Yeah.
for that
Yeah,
group.
it sounds wonderful. I'll have to check it out. I do know that, we've been on for over 45 minutes.
Oh my
Oh my
goodness.
gosh. We did have questions about nutrition and whatnot. I would just want everybody to know, if they have questions about nutrition. Um, we do have nutritionists coming on next month. Make sure that you've joined our Facebook group, Keto for Lipedema, the Keto Lifestyle for Lipedema, or reach out to me. I'm Gail at lipedemasimplified.org with the hyphen in there. Most of you guys know how to get a hold of me. Anyways, and we can I'll answer questions about nutrition if I can. And if I can't, I'll steer you to Carrie or Jill. They're they're starting their next small group nutrition coaching in next week, I do believe. But for us today, we're talking about compression, about manual lymph drainage, about exercise, all the physical modalities here with Adie MacKenzie, who is one of our coaches. And Adie, to wrap this up, if there is one message that you would love to have echoed around the world, what would it be?
Oh my goodness. Keep moving, keep breathing.
That's wonderful.
I feel like
Because when we
Gimli, the the dwarf, you know? Keep breathing, that's the thing.
That's the keep breathing, because
Mhm,
breath is so vitally important. And with that, I wanna share that there's hope. You're not alone here. We're
mhm,
all here for you, and, we hope that you have a wonderful day or night wherever you are, and
mhm.
we'll see you next